Another Thursday for us to discuss on health-related issues. Good afternoon, ladies and gentlemen. Thank you so much for taking a rendezvous with us on today's edition of the program, You and Your Health. For presentation, I am Immaculate Fogwe. Being aware of the type of contraceptive method to opt for when trying to prevent unwanted pregnancies is very crucial as a woman. Today we'll be looking at the use of pills and condoms when it comes to preventing pregnancies. Meet our guest in some few seconds. Thank you so much for choosing Equinoxe Radio Multimedia. And with me in the studio, as always, is our beautiful Asia Lucilengo. Hello, my co-host.
Hello, Immaculate Fogwe.
How are you?
I'm good, and you?
I'm great. So you have the duty,
of course,
everything to present our wonderful guest.
Yeah, and ladies and gentlemen, our special guest for the day is Marivon Agbor. She is a sexual health specialist. Good day to you, nurse.
Good day, my loves. It's a pleasure to be here today.
It's a pleasure for us having you here, of course, for the first time, right?
For the first time. You're welcome.
Exactly, Lucy. You gave the precision, her title.
Yeah, she is a sexual health specialist.
Okay.
Yeah.
So now, we are going to be talking about something which is very crucial when it comes to reproductive health, and we are talking about women. We know we have a lot of televiewers, a lot of listeners who are watching us and listening to us at the moment, and they want to know a lot about this. Tell us more. What is birth control method all about?
Okay. So birth control is all about the use of medications, devices, or surgery to prevent pregnancy.
Mm-hmm. And now, what are the different types of birth control methods that exist?
Now, the different types of birth control methods. We have pills, we have intrauterine device, we have implant methods, we have injections, we have what we call vasectomy, which is a type of male preventive method, in which they have to cut off all the sealed ductus duct. We call it that duct. It helps to carry sperms. We have others like hysterectomy, where they remove the uterus. We have things like oophorectomy, where they remove the ovaries.
Okay, so now let's focus on the oral methods. Are all of them the same?
No, all oral method pills are not the same, because there are two different types of oral control pills. We have the combined pills, which is made of estrogen and progesterone, and we have the progesterone single pill only. So the two are not the same and they function differently. Like if you look at the combined pills, it has a 21 sec pack. That is to say, you take it for 21 days.
Okay.
Yes, that is 3 weeks, once a day. And looking at the progesterone only pill, it's just a single sex pill with one hormone, progesterone. So you take it for 28 days, that's 4 weeks. So they are totally different.
Okay, so let's talk about now. What if a lady is pregnant and she takes one of these pills? Is it going to abort the pregnancy, or is it going to have an effect on her health?
Now, pills in itself has effects when you take it when you're pregnant. There are mild effects on the woman, and there are also effects on the fetus. For the developing fetus, you may have effects like urinary tract on the baby. There could also be an effect like preterm labor. There could also be stillbirth. Preterm labor will mean premature. Yeah. Now, on the mother, there could be things like abdominal cramps, nausea, feeling discomfort, because these pills have natural hormones in them. So you taking the pills while you're already pregnant, there will be a kind of drifting of power between the pills and the fetus in your womb.
Now, what if a lady takes a pill all the time? How often should a lady take a pill?
Now, the weight at which you need to take the pills depends on the kind you're going in for. Like I earlier said, for the combined pills, you take it for 3 weeks. That's 21 days, once a day. It's so disheartening that many people are not informed. You see somebody's taking a pill morning, night, evening. It's wrong. So you take it once a day for 21 days. That's 3 weeks. But it depends on that which you're taking.
Wait, I want to understand.
Yeah.
We have some pills, different type of pills, just one tablet,
yes,
like we know already. And now you're talking about another which you take for 21 days.
Yes.
Is that another set of pills?
It's another set of pills. It's a controlled pills for preventing pregnancy.
So you take that every single day?
Every single day. What you're trying to ask, you're talking about the emergency pill, like example, Postinol.
Exactly.
With
Postinol, I think that's what's even more popular in Cameroon.
Yes. So with Postinol, you can take at least 5 days after unprotected sexual intercourse. That's an emergency pill contraceptive. But now with the progesterone or the combined pills, you take it continually for 3 weeks. That's 21 days. Or you take the one for 28 days once a day.
Yeah.
I want us to still focus on the postinol issue. Now, if a lady, maybe she thinks this month she had something, maybe, okay, she has had a sexual partner during the month and she has had more than, let's say, 7. Does it mean during those periods she has to take the pills? Will it not have an effect on her?
Now, with the issue of postinol, before you take it, you first of all need to know your ovulation.
Okay.
Oftentimes, ladies take this stuff without even knowing how to take it. Now, if you've had intercourse, let's say, on Monday, you should endeavor to take these pills. Latest should be Wednesday. It shouldn't be above 3 days because it's potential to work at least 5 days or 7 days after your unprotected sex. So if you had intercourse on Monday and you're going to take postinol on Thursday, it won't work. It should be latest at least 3 days after that intercourse.
Okay, nurse, what if you take the postinol, you have an unprotected sex maybe today, you take postinol, and maybe 6 days after, you still have an unprotected sex? Is the postinol still going to work?
No.
Or you still need to take another?
You still need to take another.
And what are the effects you taking it like
Continuously, exactly.
Continuously to the system?
When you take it continuously, what you're doing is already drug misuse because people are not informed. First of all, we need to understand that the organs that are involved in drug distribution, we have the brain, the kidney, and the liver. So when you keep on taking medications out of its prescription, you are putting these organs already at risk, and you will put them at the level of malformation. That is, in the long run, they will not be functioning well. And the time will come, your system will be autoimmune. That is, it will be resistant to the drug. It won't be corresponding. Like I have cases of women who have taken postinol for about 3 years straight, and at one point it couldn't work. They got pregnant even while taking it.
Wow.
Because that system already became used to it.
Ima, before we continue,
the numbers for sure.
The numbers for those who like to join us on today's edition of the program. You have 670-547049. I repeat, 670-547049 or 656-622222. 656-622222.
Nurse Marivon, I want us to still discuss on how to take these pills, especially focusing on these emergency pills. Now, you talked about a lady taking it continuously for 3 years. How often? I want you to give like in a month, how often can I take this particular pill?
Well, in a month, if you want to take the emergency contraceptive pill, you should take it just during you're ovulating.
Just that. That's it. And the next one, you still take it just when you're ovulating. Oh, okay.
But one of the reasons why some ladies just take it all the time after sex is because they don't even know their ovulation period. So they are just being skeptical, like maybe I carry belly this month. They don't even know the actual time. At any instance they have intercourse, unprotected sex, they go in for it, which is absolutely wrong.
And also, we have made mention of some of the side effects. Can also taking this postinol or this oral contraceptive maybe derail or delay our menstrual cycle?
Yes, there are a whole lot of effects of birth control pills. One of which we have interrupted menstrual cycles. Some people will bleed, while some will just have spotting.
I guess we have a call on the line. Let's take this caller, they'll get back to you. Hello? Hello? Please, can you turn off your receiver, please? Turn off your TV or radio sets. Please, before you call, make sure your TV or your radio set is turned off so we can clearly get you and you can ask your questions. Okay. Doctor, I think you were saying something?
Yes. Okay. In relation to the side effects of birth control pills, there are a whole lot of them. I spoke of the interrupted menstrual cycle. Menses could actually delay or come more heavier or lighter. Wow. So another if side effect could be bloating, so women will be like, I feel inside of our trouble, like, such stuff. Yes. Some people will be having abdominal cramps, severe abdominal cramps. Some will have decrease in libido, like reduced sexual anxiety. Some people will have interruption in their cervical mucus. Wow. Hence, they are exposed to vaginal yeast infection. We call it thrust. Wow. Some will be having deep thrombosis. We call it blood clotting. So there are a whole lot of side effects when it concerns oral pills.
Okay, nurse. So let's talk about who should take this oral contraceptive. Maybe the age. From which age should a girl or a female child should consume this oral contraceptive?
Now, when it comes to who should take it, it's advisable for those who have attained maturity from 25, 26 right up to 39. And there are those who aren't supposed to take. Like, for instance, people who have a history of Helicobacter adenomi.
Doctor, please. Just break it down for us.
Yes, I'm coming.
Okay.
You know, when we talk of Helicobacter adenomi, we are talking about benign liver tumors, that is non-cancerous liver tumors. Some of these people are not supposed to take. So even if you're at that particular range and you have this condition, you are not supposed to take. There are people with what we call Helicobacter carinoma. These are people that have malignant or cancerous liver tumors. They are not supposed to take them as well. People with high blood pressure, people who have breast cancer, people who have any history of brain tumor, they are not supposed to take.
We'll come back to that.
Okay.
Hello?
Hello.
Yes, sir. Good afternoon.
Good afternoon.
Your name, where you're calling from, and your question.
I'm calling from Boya, and my name is Sped Mukube.
Go ahead with your question.
I just want to ask, is it usual for if you have sex on protected sex today? You take Postinol, and then the next day again, if you have that unprotected sex, you take Postinol.
Okay, I think you already answered that question, but for the sake of doubt, we'll just answer it because can you answer?
Okay, I earlier said it's not advisable that if you want to take Postinol, make sure you're on your ovulation period. You take it at that moment to prevent pregnancy. So if you had sex on Monday, for instance, and you took Postinol, you won't be able, it's not advisable to take it on Tuesday again if you had an unprotected sex, because that Postinol is an emergency contraceptive and its potential to work for about 5 to 7 days after taking.
And what should we consider when we are taking Postinol or other contraceptives?
Okay. Before taking oral pills, contraceptives, there are things you need to look into. First of all, your health status. Like I listed those who are not supposed to take them. Cancer and all that. Your age, if you're smoking. Now, when you consider your age status, another thing you need to look at the protocol. These things, they differ. There are some that if you start on Monday 7 a.m., you need to take it on Tuesday 7 a.m. You don't skip. So before you go in for Postinol or any other birth control pills, you need to follow the protocol. You know about their protocol. You know about the cost. If I take it this May, will I be able to continue in June? You need to consider. Another thing is you think about the side effects. They have different side effects. Will you be able to cope with the side effects? Are you in an environment where maybe they could handle the side effects in terms you start having them? You need to consider all those stuff. When do you want to have another baby? All these things needs to put into consideration. And now, how relieving will these effects be at your area of exposure at that particular moment?
Is it necessary for someone who wants to prevent pregnancy to go to the hospital and ask if I should rather opt for these pills or some other option?
Yes, it's very, very important. You know, when we come to the feminine health, it's a kind of little complicated with reproduction. And I always advise women, you don't do anything because you heard your neighbor say she did this. So before you go into any contraception of any kind, you go visit a gynecologist or any healthcare professional. Don't go to a pharmacy and just buy. There they will consult you. They will educate you more, because when it concerns this, we educate more before giving you what to take. So through that education, a couple of exams will be done, and then they will know what to give you.
I think maybe we'll be having, you guys can call and participate in this program. I think Lucy has already given the numbers. You can call and ask your questions as far as the program is concerned. Now, back to you. Let's look at condoms. How effective are they when it comes to preventing pregnancies?
Now, condom, like any other birth control, it's 98% and not 100% effective. Out of 100 couples or partners who use condom as a measure point of prevention, 5 came out pregnant, and they were like, wow, how possible? And now there are some things we fail to look into. Now, when condom is too bigger than the man's manhood, I don't know if I can be calling my medical languages, bigger than the penis, if I'm permitted.
Manhood is better, I think.
Okay. Now, when you use a condom bigger than you, it won't size. There will be leakage. You see, it won't fit in. So during that leakage, and you have ejaculated, there's a possibility that sperms could leak out and go into the woman's outermost part of the vagina.
Okay.
And sometimes when men want to put it on, due to so much anxiety, there may be a tear without their knowledge. And so when that happens, you won't know maybe there's a leakage somewhere, and of course sperms will definitely leak out. Another case in point is some people, after ejaculation, they still insist to be in.
We have a call on the line. Let's take this caller. Hello?
Yes, madam. Good afternoon.
Good afternoon, sir. Your name, where you're calling from, and your question, please.
This is Mr. Johnson from Yaoundé.
Okay. Go ahead, your question.
Okay, please, I would like to ask Madam Doctor. She said pills could be taken for about 21 days. But to my knowledge, I know that ladies have the period which they are safe and the period which they are unsafe. So does it mean that even during their safe period, even they have unprotected sex, they should be taking the pills?
She made mention of two different types of pills. Just clarify him on that.
Okay, sir. Thank you very much for that question. Now, let me answer your question. When we are talking about the one for 21 days, we are talking about the pills control. There's a difference between the control and the emergency. With the emergency, like you can take it immediately after sex. But when it concerns the general control pregnancy preventive, as a measure of prevention, you take it for 21 days. You are not just taking it because you don't want to get pregnant for that month. You are taking it as your own route of prevention.
Now, we are being told that soon. Lucy, you have any other question before we end?
Yeah, can condoms cause a dysfunction in men?
Yes. There is what we call condom-induced erectile dysfunction. And this happens often when most men use condoms which are actually smaller than their manhood. You need to consider, before using a condom, you need to consider the size of your manhood and know the size of the condom you're going into. Now, when you take a condom which is smaller than your manhood, when you put it on, it becomes too tight. So when it's too tight, you might have difficulties to stay hard, that is to stay erected. You may actually face difficulties in erecting. And there's possibility when it's too tight, blood will not actually flow well to the manhood. And that will cause a problem. It will cause erectile dysfunction. And also, when you're having a condom on for intercourse, psychologically you're already distracted because you are like, you go do the thing, So when that happens, you will not exercise yourself to the fullest because you are not 100% present in the activity.
Thank you so much, Nurse Marivon Agbor Kerchen, sexual health specialist. Thank you for being part of the program today. Equally, thank you to you, Lucy, for being part of today's program. I equally want to thank all our technicians who are currently on the dashboard, Bertrand Bonzinel, Malis Mukumu, for their technical assistance on today's edition of the program. For presentation, I am Immaculate Fogwe. We thank you so much for your keen attention. Stay in the company of more interesting programs, of course, on Equinoxe Radio and television. Bye-bye for now.